I am Kayla Livingston. I'm a registered nurse and this region's maternal child health coordinator. May is National Water Safety Month, so we're going to talk a little bit about water safety and drowning prevention measures today. Drowning is the process of experiencing respiratory impairment through submersion or immersion in a liquid. There are three types: fatal, non-fatal with injury, and non-fatal without injury. There are some common misconceptions around drowning and terminology used with drowning, including things like dry drowning, secondary drowning, delayed drowning, near drowning. All of those are incorrect terms. It's drowning is what it is. A drowning is a drowning. If your child experiences symptoms within minutes to even hours after getting in the water, you want to get them evaluated as soon as possible. So maybe coughing persistently, extreme sleepiness, trouble breathing, irritability, acting unusual or funny in any way, and chest pain. That can be a non-fatal drowning if they survive this episode, and you would want to get it treated immediately. Did you know that drowning is the leading cause of unintentional injury death for children ages 1 to 4 in the United States, and is the third leading cause of death in our children as far as injury goes in Louisiana, ages 1 to 14. Approximately 6,300 non-fatal drownings occur every year and are treated within hospital emergency rooms, and the majority of those involve children under the age of 5. So for every one child that dies of drowning, 8 children are being treated in emergency rooms for non-fatal drowning injuries. So the percentage of childhood drowning rates in both the U.S. and Louisiana are highest in children ages 4 and under, and then it kind of decreases a little bit from the age of 5 to 14, and significantly increases again after that age of 14. Boys are statistically much more at risk than girls for drowning. The school of thought on that is that they take more risks, generally speaking. And in Louisiana, Black children are 1.3 times more likely and more at risk for drowning than white children. Racial disparities exist across all of our causes of death in Louisiana. Others that are at risk include children with epilepsy or seizure disorders and children with autism spectrum disorder. So other risk factors include not being able to swim. That's a no-brainer, but missing or ineffective barriers like fencing or alarms, lack of close supervision by adults, location, and that can vary by age. Rural settings are generally a higher risk. Not wearing life jackets in open water, and drinking alcohol or using drugs when moving around in the water. So how fast does drowning happen? You have 30 seconds generally is the time that it can take to drown. It's as little as that, so that's the time it takes to send a text or to run and grab a towel out of the house real quick. And then after the drowning occurs, you have 5 minutes to get resuscitation started before brain damage begins. Where are they most likely to drown? It depends on the age. Children under the age of 1, infants, are most likely to drown in bathtubs, while children ages 1 to 4 are most likely to drown in pools, and 5 and over drownings occur more often in open water settings, so rivers, lakes, things like that, boat ramps. And these drownings are most likely to occur at times when they're not supposed to be around the water. In Louisiana, from 2019 to 2021, our top risk factors for drowning were no barriers to the water source, the child was unable to swim, and or they weren't supervised appropriately. So how do people die from drowning exactly? They begin by struggling for 20 to 60 seconds, usually in that time frame, trying to reach their head above water to get air. At that point, what's called a laryngospasm happens, and it's the trachea closing off to protect itself until the body passes out, in which case the throat relaxes and water begins to enter the lungs. At this point, respiratory failure and cardiac arrest occur due to the lack of oxygen being given to the heart. Bystanders can sometimes get a pulse back with CPR. However, death can occur later as the brain damage becomes more apparent. Okay, now that we know the mechanisms behind drowning, let's talk about how to tell if someone is drowning. Do you know how? Can you spot it? Children often do not flail their arms. They more reach up as if they're trying to grab a hold of something. So you may not notice this. It may look like normal playing activity. Infants and toddlers might not even move their arms much at all. And so things you can look for is the head tilted back, kind of gasping for air. There may be some flailing. A lot of times their body is straight up and down. If you see kind of glassiness in the eyes or hyperventilation, those are all things that you can look for. And again, it can only take 30 seconds at most, so it's so quick. You have to be paying attention. Prevention is the best key for drowning. We don't want to get to the point that we need life-saving measures. We want to get on the front side and prevent it. So think about Swiss cheese. There's holes in the cheese, but if we have layers, then you have things that fill each hole. Organizations that promote water safety have the layers of protection that they promote, and that can be the 5 layers of protection, or some agencies even break it down even further into 7 layers. So let's talk about those. So one example of the layers of protection that involves 7 is the RESPECT acronym. So recognition of unsafe situations, education, learning what can lead to drowning and how to prevent it, supervision. Children should always have supervision around the water, direct and indirect. Physical barriers must be in place, and that's your fences and your pool alarms and your door alarms. Expectations, what you expect for children's behavior around the water and what is considered safe and what they can do and what they cannot do. Communication, so communicating those expectations and safety measures, and also training in CPR. Another example of 7 layers of protection is from the Judah Brown Project, a nonprofit in Texas who promote water safety due to the loss of their son, Judah Brown, approximately 9 years ago. Number 1 is effective supervision. So not being distracted is key. Not sending a text on your phone or running to go to the bathroom or turning to talk to your friend. Segmented supervision. So we promote the idea of a water watcher, someone who is having that effective supervision and they're not distracted. But you want to segment that to give people breaks. So you switch out your supervisor every 15 minutes to give them a chance to go do what they need to do and not get complacent with the monitoring of the water. A pool fence is number 3. It should be 5 feet tall and have 4 sides and a self-locking gate, ideally. A window and door alarms are another one, and don't forget about your doggy doors. A pool alarm and survival swimming lessons, if possible and available. And number 7, CPR, including breaths, because with drowning, you can't only do the hands only, you have to include the breaths. Okay, now that we know about layers of protection, let's talk about swim lessons. That's one of our layers. Survival swim, you may have heard of it, versus traditional swim lessons. Survival swim lessons are the best choice for children ages 6 months to right under 6 years old. They're in that stage still of not having the coordination skills and upper body strength to be able to maintain traditional strokes well enough to use in a water emergency. So we reserve traditional swim lessons for children 6 and up. It's a good choice for them because they have the strength and coordination skills to stroke effectively if they need to get out of an unsafe situation. Okay, so let's talk a little bit about the details of survival swim. A lot of people find it daunting because of how rigorous it is in nature. The lessons are one-on-one with an instructor, 10 minutes a day, 5 days a week, for usually 4 to 6 weeks at a time. And research shows that muscle memory is the most effective way to learn swimming and different life-saving techniques like that. And it also shows that children become fatigued after 10 minutes. So the traditional swim lessons that are offering 45-minute sessions, they're not retaining the muscle memory that they need when they're young like that, and they're also not able to handle it because they get tired so easily. That again is why survival swim is the best choice for children under the age of 6. So more on survival swim, it teaches a child or even an infant, if they're able to sit up, they can start as early as 6 months of age, 6 or 7 months, and it teaches them to roll on their back to float, and then turn onto their stomach and propel themselves toward the side, roll back on their back to float some more when they're tired until eventually they reach the edge. It's a swim, float, swim sequence, and that allows them to get out of an unsafe environment without having to expend too much energy. And what do you do if you don't have access to survival swim lessons, whether it's not in your area or you don't have the resources to pay for the lessons themselves? By the way, there are swim scholarships available nationwide. If you want more information, that will be posted as well. But make sure with non-swimmers and children who are unable to swim to use one-on-one touch supervision in the water at all times. Okay, so what do I mean when I say touch supervision? I mean never being outside of arm's length of the non-swimming child who's unable to swim at any point in time. So you want to be in the water with them, with your hands on them, touching them at all times, moving them through the water by holding them, letting them learn what it feels like and what their body's capable of and what it's not capable of. Having them ask for permission to get into the water with you. This gives them a healthy respect and understanding of the dangers of the water. That way they're less likely to enter it by themselves at a later time without you. And if for some reason there's not enough available adult supervision to do touch supervision with all the children that are involved, then you can try some alternatives like go into a splash pad or getting a sprinkler system. It's not the same, but kids still love it and they still have a great time and they're safe. Also, again, establishing a water watcher, so someone who is not distracted, not looking at their phone or eating or talking to a friend or anything like that, to watch the water as a whole in addition to your touch supervision. All right, and just for a minute I want to touch on fences, doors, and alarms. Ideally there should be a pool fence at the pool around the deck, not just a wooden barrier fence on the outside of the yard, but an actual pool fence that is 4 to 5 feet in height with a self-closing and self-latching gate. Unclimbable with no furniture around it for children to climb on, because if they can, they will. And don't forget about your doggy doors. We've had lots of toddlers access pool yards through doggy doors, and people just don't think about that, but they can easily slip out the door and into the water. Let's talk about bathroom safety. So just a little reminder that children under the age of 6 should never be left alone in the bathroom by themselves, unattended in the bathtub. They should also not be left alone anywhere that there's any sort of standing water. So even a mop bucket, people forget about mop buckets and Tupperware containers and things like that. Make sure you empty the bathtub after the bath. Older siblings should not be left in charge of younger siblings' safety. That's not fair to any of the children involved. Never leave them alone with water, period. You can get toilet locks, door locks, all of those things that you need. The toilet locks are great once you learn how to use them. Use a baby bath thermometer too, just to make sure you have the safe temperature for your water. Just a reminder there. And babysitters don't need to be bathing your children either. Just save that for when you get home or before you leave or for the next day, just to be safe, because you know the safety rules in your house and they may not necessarily. And if there's more than one child, they could be distracted. What to do if a child goes missing? If there's a water source nearby, the first thing you should do is check the water immediately. Timing can mean life or death. If you find the child in the water, get them out as soon as possible and begin CPR with those breaths. If it is not safe to get them out of the water yourself, then call 911 and wait for help to arrive. You don't want to cause 2 unsafe situations if you're not able to safely get them out of the water while also keeping yourself safe. Continue CPR until help arrives. If you have another adult there with you, you can alternate CPR so that you don't get too fatigued until emergency response gets there. If you suspect that a child has taken water into their lungs, take them to the ER immediately. So as we enter water season and moving into warmer weather where everybody wants to get out and enjoy the water and the sunshine, don't forget about the importance of water safety and drowning prevention measures. Pool time is a great time for children to learn how to interact with the water and learn what their bodies can and cannot do. So make sure that they learn that safely. Letting them get into the water without you teaches them that it's okay to get in when you aren't there.